How can we use DIM, a natural estrogen modulator, to help control estrogen levels while on testosterone replacement therapy? This topic has gained great interest in recent years because of the greater concerns around the use of aromatase inhibitors. So today we're going to talk about the difference between utilizing DIM and an aromatase inhibitor and how it can affect estrogen levels while on testosterone replacement therapy. When using testosterone replacement therapy, not only will our testosterone levels rise, but in turn, so will our estrogen levels. This isn't inherently a bad thing. Estrogen is required for a lot of physiologic functions in the bodies, in men the same way that it is in women. But testosterone being the dominant hormone, and then when it goes through aromatization, or the conversion of testosterone to estrogen, that's how men primarily get their levels of estrogen in the body. So estrogen is vitally important for lubricating joints, for cardiovascular health, for libido, for cognitive health. It has a lot of functions that are very important. But when levels rise too high in the body, we can get estrogenic side effects, such as gynecomastia or the development of male breast tissue. A lot of men experience bloating or water retention, and some psychological effects as well. Some symptoms of low estrogen can be things like dry joints or increased injury or actually decreased libido or effectively worse cognitive function because of the lack of estrogen and its impact on neurons in the brain in a healthy manner. So initially, a lot of clinics prescribe, when they don't quite understand this fine-tuning balance between testosterone and estrogen, is an aromatase inhibitor to everybody. And this leads to high levels of testosterone and very low or completely bottomed out or undetectable levels of estrogen. And like I previously mentioned, too low of levels of estrogen can have significant side effects. So this leads a lot of people down the rabbit hole of what can we use to more naturally, per se, decrease estrogen. Again, it's not that aromatase inhibitors are inherently bad, they just have to be used in a correct manner. So natural alternatives can be used in conjunction or as an alternative if estrogen levels aren't too high. So what can we use? We can use something like DIM or diindolylmethane. What is DIM? DIM is a metabolite of indole 3-carbinol, which is a naturally occurring compound in cruciferous vegetables, things like broccoli, kale, and even cauliflower. So when we eat those and they enter the body, the stomach acid converts it to another metabolite called diindolylmethane or DIM. This DIM then has the ability to convert more estrogenic or more proliferative, powerful forms of estrogen in the body to a less powerful form called 2-hydroxyestrone. DIM may also be able to inhibit some strong forms called 16-alpha hydroxyestrone and then 4-hydroxyestrone. These estrogenic metabolites have been seen in pathogenic models of increased growth of tissues and can have essentially just problematic effects in men. DIM also works in some models or in vitro models, cell models, in studies to have some minor aromatase inhibition. So an aromatase inhibitor, again, is the enzyme aromatase that takes testosterone and converts it to estrogen. And when we take a drug and we completely block that with an AI or an aromatase inhibitor, we get no conversion at all. That is not always a good thing, and so DIM can be used in mild elevations of estrogen while on TRT to have a minor aromatase inhibition effect, while also helping with the conversion of estradiol to the more weaker and beneficial forms of estrogen that can then be excreted when it goes through the second phase of liver detoxification, and then it goes out into the bile and into the urine and into the feces, and we actually can decrease total estrogen levels in the body and make sure that it's not being recycled. DIM may also benefit other detoxification pathways in the liver, and it has been shown to have some minor antioxidant effects. So when would you want to use DIM and when would you want to use an aromatase inhibitor? It's my opinion that when estrogen levels are very high, that an aromatase inhibitor should be used, because in that situation, it's unlikely that DIM is going to be strong enough to help with decreasing the estrogen, especially if a patient is having the side effects of elevated estrogen on their testosterone replacement therapy. If testosterone is maintained at steady state levels and a patient is noticing just minor increases in their estrogen and they want to bring it down because of potentially some water retention or side effects that they're noticing because of the higher levels of estrogen, in that situation, DIM may be a good option. It may be a good option for the reasons previously mentioned, and in other scenarios where there's a more mild but slightly higher elevation of estrogen, patients can even use DIM alongside a lower dose of the aromatase inhibitor to make sure that they are still getting estrogen levels at a healthy range within the body. So, long story short is that it's my opinion that when estrogen levels are very elevated, an aromatase inhibitor should be used to bring estrogen levels back down into a healthy range, and then we can then figure out more natural alternatives to decreasing estrogen levels with things like DIM or even higher levels of zinc and calcium D-glucarate, which is another natural alternative to decreasing total estrogen levels. Or in situations where patients don't want to use higher doses of the aromatase inhibitor and it's safe to use a lower dose alongside some of these more natural alternatives like DIM or calcium D-glucarate or zinc, that may be a good option there. So if you have any more questions about using natural alternatives to aromatase inhibitors on testosterone replacement therapy, some of their health benefits, leave them in the comments and we can make another video on this.